It was really very enlightening. I've heard some of the things before, some of the same things that we heard today. I've heard before the challenges that you face, but seeing it firsthand makes all the difference in the world. So I'm very, very pleased with having been here today. It was well worth my trip.
Well, I've been in case management a long time, and just in the last few months, really, we are seeing a change. It's becoming really difficult, especially with our managed Medicare patients. The primary care physicians in the community, that's another issue. It just really becomes a clog, and those patients are stuck here.
And this is what I was talking about with primary care. So if we can get people in to see their primary care physician right after their stay, then they've got a better chance of not being readmitted to our hospital.
It just puts things together, the needs of the hospital. For example, there's parts of the hospital that definitely need updates and upgrading and things like that. And just actually hands-on, it's harder to forget something when you walk around and look at it personally than if you just hear it in a committee in Raleigh. So I think it was good to have the legislators here today to actually walk through the hospital, walk through the rural hospital that has different needs from the inner city hospitals and the bigger hospitals, I guess.
And I know everybody's after you to spend your dollars from the legislature on whatever their problem is. Just countrywide, there are fewer and fewer facilities for mental health patients.
Everything we hear in Raleigh is so dominated by large healthcare systems and others, and it's really important to make sure that people understand that rural healthcare is a completely different animal, and what physicians in our area deal with are completely different than what you're seeing in urban areas. What patients see in their room and experience is very different. And just to be able to walk through again and see that kind of from this observer side, I think is very valuable.